My name is Sarah Rush, and this is a short but information-packed video about Ehlers-Danlos Syndrome and some of its related conditions in honor of Rare Disease Day 2014. This video is mainly referring to EDS hypermobility type, though some features may apply to all types. For this year's video, I'm going to focus less on my own experiences and more on the cold, hard facts. EDS affects between 1 in 2,500 to 1 in 5,000 people, but some experts think the rate could be even higher. EDS is caused by a defect in the structure, production, or processing of collagen or proteins that interact with collagen. The collagen in connective tissue helps tissues keep their shape. Collagen is an important contributor to the physical strength of skin, joints, muscles, ligaments, blood vessels, and organs. Abnormal collagen makes these structures more elastic. With all this said, it makes sense why we bruise so incredibly easily. Think of an EDSer's ligaments like a rubber band. Over time, they get stretched out more and more and therefore aren't tight enough to keep our joints in place like they should. Therefore, we dislocate and subluxate, which is a partial dislocation, very easily. Our joints generally hyperextend as well, which is often referred to as double jointedness. Postural Orthostatic Tachycardia Syndrome, POTS, is a malfunction of the autonomic nervous system, specifically orthostatic intolerance, in which a change from the supine position to an upright position causes an abnormally large increase in heart rate, called tachycardia. This is sometimes, not always, accompanied by a change in blood pressure. The only criteria for a diagnosis of POTS is an increase in heart rate from the supine to upright position of more than 30 beats per minute or to a heart rate greater than 120 beats per minute within 10 minutes of head-up tilt. The reason EDS can cause POTS is that our blood vessels are too stretchy to properly constrict, so the blood pools in the lower limbs and therefore not enough blood is circulating in the brain. Some of us have a condition called Chiari malformation, which is when your cerebellum herniates into your spinal column and/or blocks the flow of cerebral spinal fluid. Chiari and EDS are often found together because we are more susceptible to instabilities of the craniocervical junction, which is the region where the skull and upper cervical spine connect. This is one of my own CT scans done post-op from my brain decompression and C1-2 fusion. Another related condition is called tethered cord, which is when a band of connective tissue called the phylum is wrapped around the base of the spinal cord and exerts pressure on the nerves that go to the legs, pelvis, bladder, and bowel. Because of the hyperextensibility of the connective tissue in people with connective tissue disorders, the phylum may become stretched out over the ears and is not visible on an MRI. In that case, it's called a occult tethered cord. Believe it or not, some experts believe there is a link between connective tissue disorders, such as EDS, and autism. It's well known that many people with autism have low muscle tone, joint laxity, velvety skin, flat feet, stomach/bowel problems, etc. All these symptoms overlap with EDS. The theory is that since collagen makes up virtually every part of the body, the abnormal collagen in the brain is what causes autism in some people. It's still a very mysterious concept, but I don't believe it can be a coincidence that an unproportional amount of EDSers are on the spectrum, including myself. It's not all that easy to spot an EDSer. EDS affects people of any ethnicity, sex, age, etc. There is also a huge variation in severity, even within the same type and within the same day for the same person. Sometimes my EDS is totally invisible, and other days I look like this. I can go from walking seemingly fine to needing my wheelchair in 5 seconds flat. And even when I'm smiling and acting fine, chances are I actually feel like this. My point is, if you don't understand someone's medical condition, just ask. Chances are they'd be happy to educate you. It's much better than having people think you're a crazy faker. If you liked this video and want to see more of my stuff, please subscribe to me on YouTube and follow me on Facebook. If you want to know even more about EDS and other related conditions I didn't cover, please check out the links below. Thanks for watching!